And I do want to say happy birthday to our network founder, Mr. Cardiff Electric. So happy birthday, sir, to you. Okay, so thanks to James H., we have a correction. A couple of shows back, we were talking about popcorn lung, and we were talking about it in relation to vaping and how we hadn't heard about it for a while, and that I thought that it was caused by the vitamin E oil that they were using in some of the knockoff vape things. Well, popcorn lung is bronchiolitis obliterans. That part I knew. And I always thought that it was called popcorn lung because when you look at the x-rays of people, it looks like little patchy infiltrates, looks like popcorn.
Okay.
That was completely wrong. Oh, no, wait, wrong one.
Oh, there you go.
Yeah, that is not correct. So, although I talked to PA Lydia about it and she agreed it looks like popcorn in your lungs, the reason it's called popcorn lung is because they identified the disease originally among workers in a microwave popcorn factory. And the workers had breathed in this chemical called diacetyl, which is a flavoring chemical used to make the popcorn taste buttery. And there are small amounts of diacetyl in some of the oils that people were using in the original sort of vape pens that people were purchasing around the country. And they felt that that was where that scare came from. Now, the other thing that had to do with vitamin E was a real thing, but it didn't relate to popcorn lung. Vitamin E acetate was identified as a cause of acute vaping-related illness. So it's AVRI, I think it's called. And vitamin E acetate is a condensing agent they use in these vaping products, and all of the injured lung fluid samples that they got when they did biopsies on people that were having this problem had that agent. So, it was this sort of mysterious outbreak, and they were vaping within the 90 days in like 2019. And we're not seeing this anymore because they're not wised up and are stopping using vitamin E acetate. You think, ooh, vitamin C is good or vitamin E is good for you. Must be good to inhale. Let me take a toot off of my vape pen, man. And no, that's not good.
Not so much.
So that was from an article in the journal Sirius, CEU. Oh, God, I'm having a problem today. CUREUS 2019, vitamin E acetate as a plausible cause of acute vaping-related illness. So I do appreciate James H. correcting us on that because we were just talking off the hook, off the cuff, and what a surprise! We didn't know what we were talking about. So, oh, and it's not. I'm doubly an idiot because it's right here in front of me. It's e-cigarette or vaping product use associated lung injury, which is EVALI or EVALI is the name of the syndrome. And the reason I don't know it is because we don't fucking see it anymore because nobody's putting that shit in their vape pens anymore. All right?
That's a good thing.
So that's a good thing.
Yeah.
All right. So that's what I have. We're going to probably be deplatformed after this next story.
Unless we could use code words.
Okay.
Let's use code words.
What should the code word be?
How about
The big I.
the big I?
So I'm looking at this is what pissed me off. Okay, here's a CNBC article. The big I. Okay, it's ivermectin. A drug once touted as a COVID treatment by conservatives doesn't seem to work, okay? It doesn't improve recovery much. Clinical trial finds. Team of scientists affiliated with Duke University found that ivermectin. I'm just going to say, I'm not going to, I don't like it when certain people call, like people Carl, Kevin, or people named Shuley, Stooley or Dooley and stuff. And, I don't like that. So we're just going to say it. It's ivermectin. Does not meaningfully improve the recovery of people with mild to moderate COVID. So Yeah, okay, good. We have talked about this for a long time that we need frigging data on this thing because anyone who has been listening to this show for any period of time knows that we never recommended that people take ivermectin.
No.
But we didn't say people were stupid for thinking that maybe it would have some efficacy. There were reasons why people thought it might be efficacious against COVID-19 because it has known RNA virus antiviral activity, and COVID, coronaviruses are RNA viruses. Maybe it would have some effect. So all during this, when people were shitting on Joe Rogan, saying he was eating horse paste, when he was prescribed, legally prescribed, and let me say that word so it comes out right, legally prescribed, off-label, by his physician, a human drug called ivermectin, which is used for a lot of things. It's very well tolerated. And Joe Rogan himself, if you listen to 2-second sound bites, you could make all kinds of claims about Joe Rogan, but if you listen to the whole thing, he said, listen, I'm a dumbass. I don't know. It was prescribed to me by my doctor. I just did what my doctor told me to do. So we also explored the fact that there were 72 studies on clinicaltrials.gov looking at ivermectin. We were never those that are saying, of ivermectin, but I did say people who are rooting for it to fail were part of the problem.
Yeah, agreed. Yeah.
We want to root for anything that's off
any
the
damn
shelf.
thing that helps. Anything that helps.
So we have molnupiravir, we have Paxlovid, thank God. You've got outpatient remdesivir, although not very many people are using it. And we do have the new sotrovimab, the new monoclonal antibody.
Okay.
So we have stuff
Right on.
now. So we don't have to worry about ivermectin so much because we know molnupiravir works. It makes people feel better faster. It improves productivity. It only decreases hospitalization in the highest risk factor folks by about 30%. But then for those people, we have Paxlovid, which is around 80-something% preventing people going to the hospital who are at high risk. And are these drugs perfect? No, but they have proven efficacy. Now, back to ivermectin, because I am an empiricist. I'm interested in the science. So here is one from October 21st, 2022. And this is in Journal of the American Medical Association. This isn't some shite journal. It says effect of ivermectin versus placebo on time to sustained recovery in outpatients with mild to moderate COVID-19. A randomized clinical trial. There you go.
There you
That's
go.
what we've been looking for. Thank you. So the question was, does ivermectin for 3 days compared with placebo shorten symptom duration among adults, outpatients in the U.S. with symptomatic mild to moderate? And what they found on that endpoint was that there was a decrease in symptom burden, but it wasn't statistically significant.
Okay.
So let me see if I can get the numbers here.
I've got it. There were 1,591 patients total.
That is correct.
Yep.
But I'm trying to find because
sorry.
No, that's what you're fine. If you have the number, the medium time to recovery. Okay, it was 12 days in the ivermectin group and 13 days in the placebo group.
Okay.
So that was shown not to be statistically significant. However, they looked at some other things too.
Okay.
And nobody, when you have, you conservatives, Jimmy Dore is not a conservative. He's as left wing as you can get. And he was like, we ought to at least look at ivermectin.
At least look at it right.
And I'm no right winger, and but I'm not one
A
of
left
those-
winger.
Well, I am. I don't know what I am. I'm left wing on some stuff, and
You're a
more-
swinger.
I'm-
You're a swinger.
I'm a pragmatist.
You're a
I want to
swinger.
do what works.
Right.
I'm an empiricist. Show
Right.
me the data, and I'll agree with what you're doing. But so I never promoted the use of ivermectin. I never told anybody they should take it. Well, I said, do what your doctor tells you to do, but that there are some very reasonable people who are at least looking at it, and they wouldn't be looking at it if it was just completely out in left field.
Right.
No one is looking at Xanax for influenza right now,
Right.
because it'd be nuts to do that. There were reasons why people thought this might do something, but there is one interesting thing in this article. It said there were 10 hospitalizations in the ivermectin group and 9 in the placebo group. So, all right. Again, not statistically significant. But the most common serious adverse effects were COVID-19 pneumonia, ivermectin 5, placebo 7. Again, not statistically significant. And let me see if I can do this properly. Venous thromboembolism, ivermectin 1, placebo 5. Now, that, okay, you've got a large sample size and very small numbers, so you can calculate the absolute risk of having a thromboembolism compared to placebo, but it would be interesting to know if it was statistically significant. So I did a chi-square analysis. You'll notice in this article, they don't say whether that's statistically significant. You know why? Because it almost was.
Oh,
It
wow.
isn't quite. We consider statistical significance to be this thing called 5 sigma. So that is, 5 times out of 100 or 1 time in 20
Okay.
that it would be due to chance. So,
Okay.
so that translates into a thing called a P number. It's a P of less than 0.05. And the P of this was 0.08, which was approaching statistical significance.
Almost
That means
one,
8 times in 100.
Yeah.
This would be due to chance, which still means 92 times out of 100, it won't be due to chance. Now, so it may just need a larger sample size
Okay.
because this is a very rare event to have venous thromboembolism when you have COVID-19. So they had 6 out of 1,800, I think the total, or 6 out of 1,591.
Okay.
So what does that work out to, percentage-wise?
Not much.
Echo, what is the percent of 1591? Shit, I asked it wrong. Never mind. Never mind. Echo, don't answer that.
9,000.
No, don't answer that. Echo, stop. What percentage of 1591 is 6?
6 is 0.3771% of 1,500.
So 0.3. Yeah, so 0.3%. Okay.
Yeah.
That's so this study may not be big enough to be able to show whether this is statistically significant. But I don't see anybody talking about this. What if, you do the molnupiravir, you do all this stuff, and if you got somebody that's at high risk, let's say they're immobile, that you throw in a little vitamin I and it will decrease the risk of thromboembolic events. And by the way, for those that don't know, venous thromboembolism is when you get a blood clot in a vein and it moves.
Okay.
So venous, vein, thrombo, blood clot, embolism, that thing's moving.
Okay.
And it usually doesn't move to a good place. It goes right into the lung.
Yeah.
Okay.
Rarely goes somewhere good.
Well, there's nowhere good for it to go.
No.
So, and that causes a pulmonary embolism. So, wouldn't that be something? I mean, it's really close to being statistically significant finding, and they're just, well, all we looked at was, no, you looked at some other things, and this one thing was actually kind of impressive. So, I'm interested in seeing if they follow up on that. So we'll see. All right. But
Wow.
listen, I'm going to say whatever YouTube says I have to say, which is ivermectin does not appear to have any efficacy for improving outcomes in COVID-19.
Right.
So we don't recommend it.
No.
Do whatever your doctor or healthcare provider says. But there's some tantalizing evidence when it comes to thromboembolism.
Yeah.
I'm going to just say that,
Which is
by
pretty
God, right
important.
now. And these were in people who had mild to moderate disease. So, who knows what we would see if in patients with
Severe.
moderate to severe
Yeah.
disease. Yeah.
Wow.
Okay.
Wow.
All
Interesting.
right. So I'm just interested in the data, and it pisses me off when people just look at one thing and say, oh, well, he says, ivermectin, there's reasons why people would be interested in studying it. So he must be MAGA, man. Come on. Come on. Looking at data in a real journal.
Right. Yeah.
And it's interesting how
And that's the only way
this
we're gonna
finding
figure
is
out anything.
completely glossed over
Yeah.
everywhere. What? Say what?
But it's just the only way we're going to find out anything is
Yeah.
to do the research. You know?
Dr. Scott looked like a MAGA maniac, but he and I agree on this.
Oh gosh, yeah, 100%.
All right. He probably is MAGA.
Hey, Carla's got a good question, real quick.
Okay.
And it's about the blood clots. Can you get a blood clot in your penis? And the answer is
Oh, absolutely yes.
Yeah.
Yeah.
Technically, you can get anywhere.
Thrombosis of the dorsal vein, that big vein on the top. Well, the part that you can see, the top.
Yeah.
And that's not good. You can get
No.
blood clots inside your penis in the caverna, that the spongy places
Right.
that fill up with blood when you get a giant meaty erection. You could get a clot in there too, and that you don't have erections after that.
No. Yeah, I was going to say that's devastating.
Let's see.
Good
Dorsal
question,
vein.
Carla.
Yes, very good one. Well, that was from thrombosis of the dorsal vein of the penis has a name. Does anybody know what it is? And don't look it up. No, you can look it up.
I don't.
I'll send a couple of poker chips to the first person in the chat who gets it, but you only have about a second while we play interlude music.
That's not how you fix the blood clot in the penis, by the way.
No. Okay, nobody
Not
got
how
it.
you
It's
fix it.
Mondor's disease.
Mondor's.
Hello, I am Mondor. Of the Mondor testicles of the island of Pinos. Anyway, yeah, dorsal vein thrombosis is a rare disease with pain and induration, meaning kind of swelling, of the dorsal part of the penis. Possible causes: trauma,
Yeah.
neoplasm, excessive sexual activity, or abstinence. So either effing too much or not effing enough.
Yes.
I may end
There's a
up with
balance.
this.
There is definitely a balance in there, isn't there?
The differential diagnosis must be established with sclerotizing lymphangitis and Peyronie's disease. Doppler ultrasound is the imaging diagnostic technique of choice. Proper diagnosis and consequent reassurance can help dissipate the anxiety typically experienced by patients with this disease. Yikes.
Yeah.
No, thank you.
That sounds awful.
I know. So everything in moderation again.
Yeah, everything in moderation. Makes sense to me.
Boning too much. Get Mondor's disease. All right. What else you got?
It just sounds awful. I've got a couple interesting things.
Okay.
I saw.
Well, if you
that-
look at my Twitter, you can see my chi-square analysis. By the way.
Oh, cool. I saw this earlier today. First patient receives potentially cancer-stopping pill in a new clinical trial.
Okay, what the fuck is this?
So that's pretty cool. So researchers at the City of Hope in Los Angeles, it's the largest one of the largest integrated cancer centers. Said they have a new cancer-stopping pill, and
Okay, by the way, this was published by City of Hope.
yeah, let's say this. Yeah, this is not. I didn't find this on.
No, I
PubMed.
know, but it's a phase 1 clinical trial.
Yeah, but what?
So they're tooting their own horn, by the way.
Right. Yes, and what they're hoping is that they can use this. It works on stopping the cells from multiplicating and
Multiplicating.
That's not even a word, is it?
Well, I know my multiplicating table there.
Replicating. I apologize.
To do some ciphering in the gazettas.
my gazentas.
2 gazenta 4 twice.
My gazentas are firing on half a cylinder today, but
That's proliferating cell nuclear antigen. And it plays an essential role in the replication and repair of cells.
Right.
They thought it would be a less toxic cancer therapy. So they're targeting these mutant cells while leaving normal cells alone. So I'm very excited about this.
And
Let's
they're showing some promise against working with promising against breast cancers, prostate cancers, ovarian cancers, skin cancers, lung cancers. But what they're saying is that maybe they can use this in connection or conjunction with other existing chemotherapy
Oh, sure.
medications, which would be so you'd still have a great attack. But I think they were trying to use this for some of the cancers that have become resistant to therapy.
Yeah.
So just some adjunctive therapies is what it looks like.
Wow.
Wouldn't that be cool?
Is this some kind of? It says here, don't you do the good manufacturing practice thing? Isn't that what you do when you make your thing?
Mm-hmm. Mm-hmm.
You have
Yeah,
to
for
get
the Simpler
certified through that.
Herbals, Simpler Herbals, yeah.
She said good GMP facilities are manufacturing her medicine. Is this some kind of herbal shit?
Oh, I don't know. I didn't read that part.
I mean, how cool would that be if it actually worked?
well, and Dr. Stephen, and
And when I say herbal shit, I don't mean, is it?
no, I know what you mean.
I'm just using that.
No, I'm the
as-
one that uses the herbal shit like flying
yeah.
squirrel feces.
Yeah.
But that's different, of course. But most of these medications that you use in chemo as chemotherapy agents come from, they're a derivative of some plant or animal.
Oh yeah,
Yeah, for the
absolutely.
most part. Yeah.
Oh yeah, most our antibiotics were all found by having fungal cells that were killing bacteria in petri dishes, and then you cut out the piece of the petri dish where the cells, or where the bacteria won't live,
Right.
and then you run it through a bunch of different analytic tools to figure out the structure of whatever the hell it is
Right.
that's in that petri dish that mold created. And then you can take that and you can start changing it. Once you get the basic structure and you figure out how it's preventing bacteria from replicating or how it's killing bacteria or how it's signaling the immune system, you can change a methyl group here or a hydroxyl group there and make it more or less potent or change the targets and do all kinds of stuff. So, yeah, all of the cephalosporins, it's a broad group of antibiotics. That's how they were discovered.
Huh.
Yeah, pretty neat.
That's incredible.
And penicillin was a mold.
Yep.
And it killed bacteria. And I don't know if it's true that they would actually take moldy bread and strap it to infected war wounds. I don't know if that's true or not.
Yeah, but
But that's the
if
image
that's all
I
you've
have.
got,
Yeah.
if that's all you got, certainly.
Well, that's the image I have. And back in the beginning, penicillin killed just about everything. And then the stupid bacteria were like, well, F this.
Yeah.
We're going to learn how to be
We're going to
resistant. to it."
mutate.
And the one bacterium that has never learned how to be resistant to plain old penicillin? There's a couple of them.
Strep.
Yeah, they're very good. Okay.
Give yourself a bill.
Excellent, Dr. Scott. So, yeah, we still use regular old plain penicillin for strep throat.
Yep.
All right.
Blind
Oh,
hog
that's
stumbles
awesome.
across an acorn every once in a while.
I am interested in this PCNA study.
Yeah, hopefully
So-
it turns into something good.
My understanding is the first patient that took it tolerated it very well. So now we just have to see
Yeah.
if it works now. So let's remind everybody what a phase 1 clinical trial is. Those are small clinical trials, might have 20, 40 people in it, just to make sure that the thing sort of does what you think it's supposed to do and it's not killing people or
Right.
giving them
Not super
horrible
dangerous.
adverse effects.
Right.
Then phase 2 might have 300 people in it, and you're looking for adverse effects. And then phase 3, you could have 3,000 to 30,000 people, and you're looking for efficacy. By the way, I am in a phase 3 Pfizer trial for an influenza vaccine. That's
Oh, wow.
mRNA, and I tolerated it very well, and we'll just by gut see what happens. I did not get myocarditis. I didn't get anything.
That's a good thing.
Yeah. All right.
That's a good thing.
Are you done?
Oh, well, I've got one more if you want it.
Okay. Well,
yeah,
sure. What
yeah,
the hell?
we got a good one. It's so this is good news.
Okay.
A derivative of the love hormone oxytocin.
Oh, good. Yeah.
which is a good
I
thing.
love me some oxytocin.
Love me some oxytocin.
You can buy it over the counter at a compounding pharmacy. It's a couple of squirts up the nose, and then have a bone session, and it is awesome. It's true. It's true.
Oh
It's
my
the trust
gosh.
hormone. It's the thing that's
I'm gonna have to start taking a shot of that before I come in.
it's maybe
every
so.
Wednesday afternoon.
Maybe so. We should give it to our audience so they'll
That's right.
trust us.
Oh my god,
But
it's
yeah,
hilarious.
it's associated with bonding of
Right.
mother to child, because when children, when babies breastfeed, you have oxytocin release, and it's released during orgasm and all kinds of stuff. So it's
When
pretty
you're
cool.
strutting your stuff
And when you strutting your stuff,
and exchanging some fluid. Exchanging fluid.
all right, everybody take a drink.
So the derivative
it said
of
fluid.
oxytocin,
Okay.
and this is even the best part. Oxytocin reverses cognitive impairment and Alzheimer's disease.
What?
Yeah, no, this was incredible.
I haven't seen this one.
Yeah, this is
For
incredible.
how long?
Well,
this stuff is very short lived in
They
the body.
just found out. So the basic part of this research is that a derivative of the oxytocin is not easily accessed. It doesn't cross the blood-brain barrier well.
Yeah.
And so what they were doing, they were actually injecting into mice, and saw that it helped with dementia and Alzheimer's. So what these scientists have done is they're coming up with a different version of it that they can replicate and not have to put it into your brain directly. Where they can make it a pill or a liquid, a medicine, for lack of better terms.
Are you sure it doesn't cross the blood-brain barrier? I
No,
thought
no,
was the
no.
whole
It,
point.
it does, but it's not very well.
Okay.
Yeah, not yes, sir. Yeah, it does, but not in the doses that they want it to.
Okay.
To make it
Oh,
viable for Alzheimer's.
For
and dementia.
Alzheimer's, they want a bigger dose. Okay.
Right on. Yeah, so it's pretty cool. So that's good news. So I would say the more oxytocin that we can release,
Yeah, I think that's good.
that's another good reason to
But you would think, though, if
do your
this were
bonding
true,
with
then
fluid.
if you had Alzheimer's, dementia, and you jerked off, that you would temporarily get better.
Yeah, but you know what? When you get to that age, the odds
they're
on
not doing
getting
a
an
lot of-
erection are
that's
zero. So, but it kind of makes you wonder if you gave someone the intranasal application of the oxytocin, if it made them have
Yeah.
momentary lapses of
Yeah.
kind of being aware or being with us. So that's the good news.
There are. Have you heard about this stuff using etanercept, which is, I guess, Enbrel? They use it for
Improl for
Crohn's disease and
right.
stuff like
autoimmune
that.
disorders.
And they're using it for stroke patients.
No, I have not.
And they're actually injecting it into the base of their brain. And I don't know if this is BS or not. I want to see some good studies on this. But the YouTube stuff is amazing. There's this lady. I think.
and
Oh no, I
welcome
don't.
to
Shut up! I'm not playing you.
You bring it up.
There's this lady in here that
And
has
when it
a thing called aphasia.
It's
Okay.
only been a brief few minutes.
Okay, here we go.
Now,
Let me see if I can find
she's
her.
willing to
Having the stretches is very
pain.
Okay,
Is
this.
that
I'm
something
sorry,
that
everybody.
every
This is
blood
terrible.
flow and activity are affected
There is a lady in
through
here
by
that has this thing called aphasia, and it's Broca's aphasia, and you get that when the left part of your brain, certain the speech center is affected, and these people can't find words. Worse than me, they have very much difficulty finding words, and some of them can't find any words at all. Although they can often say things like shit and piss and stuff like that. So those words must be stored somewhere else. Because I've seen people with Broca's aphasia that just go, oh shit, oh shit, oh shit.
Right.
And they can say that very fluently.
Yeah.
But they can't say anything else. I got to find this lady. Okay, here she is. All right, let's try this. Let's see if this will play.
that was reducing the effects of stroke.
Okay.
It isn't fully tested
Okay,
and
be
is
quiet.
viewed cynically by many neurologists.
Yes.
But that hasn't stopped Linda, and the results are something to see.
Yeah, this is pretty amazing. Here's this lady.
different? It's only been a brief few minutes since Linda Lumbro received that injection of etanercept at the base of her brain.
clear.
Clear. She's been tipped upside down to allow the medicine to flow into her brain.
Oh my.
Remember, this is stroke-affected Linda
Listen to
just before the injection.
One, two. Oh my.
Moments after the shot, she sits up.
Now, really, Broca's aphasia, they don't usually stutter like that or stammer. They just can't say it.
Okay.
The words aren't there. So this is something a little different. If you say count to 10 and she can do it, but albeit insanely slowly, that's not exactly Broca's aphasia. It could be partial.
The change in Linda is something to behold.
It's gone.
Oh,
Hi.
Hello there.
Yeah, and that's something. So,
what?
yeah. So I, you never know when they. This is 60 Minutes, so I'm presuming that they didn't just pull a fast one on 60 Minutes.
Right.
But I want to see the actual studies on this. So,
So the only
But
thing
it's a potent anti-inflammatory.
right. Well, the only thing I was going to say is what I have seen over in Europe are the injection of stem cells into stroke-affected parts of the brain to regenerate the brain itself.
Yeah.
But I have never heard of them using like an embryo into the. That's interesting.
Let's see if do they have any results with that stem cell
Gosh,
treatment?
it's
Because
been a
they
while.
inject stem cells everywhere.
Yeah. Yeah.
I don't. Let me see. Cardiovascular. Okay. Chronic cerebral aspects of long COVID. No, I don't care about that. Okay. Paraspinal etanercept. It advances as a neurotherapeutic. Randomized controlled trial validating the use of paraspinal etanercept to reduce post-stroke disability has wide-ranging implications. Now, this is in Expert Reviews of Neurotherapy, not a turd journal. And let's see here. The dogma has been the simple, non-invasive way to accomplish this goal is not possible with many agents, including biologicals, because they are too large to cross the blood-brain barrier. Various novel technologies to breach the blood-brain barrier have been attempted, but with little success. Okay, so just inject it, on the other side of the blood-brain barrier. Randomized, double-blind, placebo-controlled trial administered a widely used anti-tumor necrosis factor biological, which are just basically insanely powerful anti-inflammatories, and etanercept, given via paraspinal injection, which bypasses the blood-brain barrier. Turns this dogma on its head. This new trial holds much promise for stroke survivors, as well as having implications for developing treatments based on other large molecules that can't otherwise cross the blood-brain barrier. So, all right,
God.
maybe there's something there.
Well, let's hope so, because
That's not, just some wackadoodle journal.
No, and certainly we've all seen the devastation of those.
Okay, now this is this same guy. Now he published a case report,
Okay.
and it's a case report. Immediate resolution of hemispatial neglect. Okay, hemispatial neglect is an interesting one. It's when you have a stroke, say on the left side of your brain, and then they will always look to that side, and they don't think that their own hand is theirs.
Okay.
And you'll say, whose hand is that? You can hold it up and say, whose hand is that? And they'll say somebody else's. It doesn't feel like their hand. Their brain won't accept that it's theirs, which also tells you that there is a switch in your brain that says, this is mine, right?
Yep.
Because if you turn it off and it says it's not mine,
Yeah.
okay, there's
That
some
is
switch
not.
in there.
Yeah.
So, that's very interesting. So those people, that's very frustrating. They're very hard to rehabilitate because they really can't. they won't do anything with that side of their body that they're neglecting.
No.
And so he had immediate resolution of hemispatial neglect. So I would like to see that, and I'd like to hold up some hope for stroke victims that maybe some of this stuff might help them.
That would be
because
wonderful.
the brain and the central nervous system really is the last frontier of medicine. We don't know how any of it works. We thought we knew how Alzheimer's works, and now they're finding other reasons why maybe it's happening. So we'll, more on that. I used to say 100 years for that too. Maybe we're getting a little bit closer to 10, 15 years on some of this stuff for the brain.
Wouldn't it be wonderful?
I used to say 100 years for cancer, and now they're selling CAR T-cell therapy. I saw somebody the other day that had it.
Wow.
Yeah. They're doing it by lottery right now.
Oh, are they really?
Yeah, so if you are eligible, for those that don't remember, CAR T-cell therapy is this chimeric antigen receptor T-cell therapy. And what it is basically is they train your T-cells to kill your own cancer. And we talked about it years ago on this show. It's actually on our website at drsteve.com. If you look at non-pseudoscience cancer cures, there's the first case where it was used was against a woman with, or for a woman. It was against a woman's cancer. She had terminal cervical cancer. My understanding is she's still walking this earth today because of this. And now they're just doing it, but it's so it's so rare that they're just having to do it by lottery. So if you qualify for it, they'll put you in a lottery, and if you get it, you get it. If you don't, you don't. You go back to regular treatment until we can get it to everybody. Pretty cool, though.
That's incredible. Yep.
All right.
That sounds good.
All right. Let's see what this guy says.
Hey, Dr. Steve. My name is John.
Hey, John. Before we do that,
Number one thing, don't take advice from some asshole on the radio.
exactly.
Thanks for taking my call.
You're welcome,
Hope
sir.
you're doing well.
Yeah, thanks.
I'm wondering, I went ahead and accidentally knocked up my girlfriend.
Okay.
And I've always been told throughout most of my life that the tubes that go from your balls into your dick, where the sperm goes,
Yeah.
they're all tangled up, I guess, or something. And that my likelihood of conceiving is very low.
Well, they were wrong.
And she is thinking about terminating.
Oh.
But if this is my only chance at conceiving,
Yeah.
then I want to, try to talk her out of it.
Okay.
I guess what I'm asking is what the chances are of this being my only chance.
Okay, that I cannot answer.
Mm-hmm.
But
It's not zero.
it's not zero. That's right. Assuming that this is your kid. That's the other thing. It could. It might not be. But if you have a hypothesis that there are no white crows, and you see a black crow, and you see another black crow, and you see another black crow, all of those things bolster your hypothesis. But if you see one white crow, it negates your hypothesis.
Yep.
So the odds were very low, but they sure, like Scott said, they're not zero. So what are they? Is this a 1 in a million thing? Or could you conceive normally? So how would you know? Here's how you would know. Go do a sperm sample. Go to your
Right.
primary care.
Exactly, yep.
Say, I want to know what my sperm count is. What are the odds that I could conceive later? And your girlfriend got to make this decision for herself.
Yeah.
There's moral arguments. There's all these. In the end, she's just got to make this decision herself. And our opinion really doesn't matter.
We're here for the science. We're here for the science.
Our opinion doesn't matter.
No.
And really, kinda, your opinion does matter, but it kinda doesn't. She has veto power. It's like when Dr. Scott and I were in business at the beer store.
Yeah.
He was 51%, and I was 49%. So if he wanted to run it into the ground, which he did, then I couldn't do anything about it. I had some input in running it into the ground, but I didn't have the final say. And it's kind of the same thing here, is you have input. She shouldn't, I'm sure she doesn't want to make this decision in a vacuum, but I don't want you to be pressuring her one way or the other based on information that you don't know. So go find out. Now, if your sperm count is normal or close to normal, then you can impregnate somebody else. And then that takes that pressure off. But if you're going to make a decision about being a father or being a mother, you should do it for reasons that make sense, right? And right now, you don't know the answer to that. So take away that unknown and find out. And then, if your sperm count is 0, oops, might not be your kid. But if your sperm count is low, then it might be unlikely that you would have the ability to have a kid later. But then you got to decide, I've got to commit to this kid, You're going to have to commit. And if your sperm count is low, normal, or normal, then you can just go impregnate somebody else, and then you guys can have a different conversation. That makes sense?
Yeah. Oh, shoot, Jeff.
Okay. Always worried giving advice to people because this isn't really an advice show. It's supposed to be.
Well, I think we gave him the science component. Go find out if you got.
Yes.
you-
That's how you
The
would know.
bottom line is, don't listen to what we say, but just go get your sperm
That's
checked.
right. That's right.
Number one thing, don't take advice from some asshole on the radio.
And go do that tomorrow.
Yeah.
Okay.
Yeah.
Tomorrow.
Take the guesswork out
Well,
of it.
okay. Whenever you hear this. Anyway, whenever you hear this, the first business day, go to your primary care, say, I need an order for a sperm count.
Yeah.
And then if you want to send it to me, you can do that. I will be happy to look at it, and I will tell you, I will be happy to interpret the results for you in a way that's just your old pal who happens to have a medical degree, not as your doctor. All right?
Good stuff. Good
Okay.
stuff.
All right. Here's another.
Hi, Dr. Steve. This is D.R. Perkins. I'm
Hey, DR.
the fellow that has been emailing with you over the
Yeah.
past few years. Thank you for all the answers you've given me
You're welcome, sir.
in the past.
Thanks for your
Rather
support.
surprised that you remember me because
Of course.
You guys must be polymaths.
Okay, this guy, by the way, is the guy that came up, referred to us the vibrating, air shooting sex toy that is that you can look at stuff.drsteve.com.
Gotcha.
Okay, it's down at the very bottom. I separated the adult stuff from the other stuff. Anyway, but that was D.R. Perkins. I always thought it was Dr. Perkins. I thought I was talking to a colleague. Anyway,
Dr. Scott.
Hey.
Be able to answer emails, and on top of that, remember who the folks are that call you.
yeah.
I would think that being on call and being a ham radio operator and all the things you do, you must be busier than a one-legged man in a butt-kicking contest. But to get to the
Yes, sir. Oh, sorry.
describe what happened after I noticed flashes in my peripheral vision.
Okay, so we don't have a whole lot of time left, but we got a little bit. He emailed me or on the text message thing, I think, one or the other, said I'm having flashes in my vision on one side. If you have lightning flashes in your vision when you move your eye a certain way, it's either a vitreous detachment or a retinal detachment. Go see an ophthalmologist right then.
Soon, yeah.
And so I wrote back to him, and he said, well, they said I can get me in 2 weeks. I said, no. Call them back and say you've got a retinal or a vitreous detachment. They'll get you in today.
Mm-hmm.
So that's what happened. So he's going to say what happened here.
And no pain involved.
Right.
And I, therefore, was going to ignore it. He told me not to ignore it, so I, where I live, there's not very many ophthalmologists on call. I had to travel an hour and a half to find an expert to look at my eye.
It's worth it.
And
Lord, yeah.
making a rather long story short,
Yeah, not so short.
it turns out that my vitreous humor is from old age shrinking and pulling away from the backside of my eyeball.
So, yeah, so your eye, you think it's filled with water. It's not. It's like a jelly.
Mm-hmm.
It's a gel. And as you age, that gel will start to dehydrate and shrink. And when it does, it doesn't have anywhere to go. It will pull away from the retina.
Right.
When it does, fluid will rush in, because there is fluid in there, to take up the place of where the jelly was adherent to the retina. And what comes with that fluid is all kinds of cells and debris, and you get floaters and stuff. Drives you crazy. If I was a histologist, somebody that looks in a microscope all the time, I would have had to have retired probably 15 years ago when I had my vitreous detachment. So,
and what that can do is it can tear the retina, and in my
That's
case,
right.
it has not torn it
yay.
yet.
Cool.
Good.
Nothing for it because it's old age related. And
Well, okay, so if you get horrible floaters, they can actually do a vitrectomy where they take out the vitreous humor. Think about that. Your eyeball is a closed sphere, so they got to cut into your eyeball.
It's going to look like a deflated balloon.
Yeah, right. And we could talk about that someday too.
Yeah.
I've seen one of those. And they suck it out and then they put saline back in it. The problem is that there's an increased risk, of course, of infection. And if that eyeball gets infected on the inside, you lose the eye.
Yeah.
So they don't want to do it unless they absolutely have to, because I was, talking to my retinologist about it. He said, "I'll do it, but I don't recommend it."
Ugh.
It's like, okay, if you don't recommend it, I'm not
No,
doing
hell
it.
no.
I'm not going to force you into something.
I hope I'm pronouncing that correctly.
Yes, of course.
Vitreous humor.
Perfect.
Perfect.
And I really don't have much of a humor about it, but and I have to ask you and Dr. Scott,
Fuck
when
yeah.
you have guys like me that call in and try to pronounce Latin words,
No, it's just Dr. Scott.
do your patients in doing that produce a stigma upon themselves, sort of like a Yankee trying to
No.
talk Southern?
No, because I use plain words anyway. Physicians should be, healthcare providers should use plain words.
Mhm.
And we've talked about this before too. And thank you, Dr. Perkins. It was a great phone call, and I really appreciate the follow up. And there might be somebody out there that will help.
Yeah, exactly.
But even using positive and negative, we shouldn't use that. We use that differently. If you have a positive checkbook balance, that's a good thing. If you have a positive attitude, that's a good thing. If you have a positive biopsy, that's not a good thing. It's not a good thing. It's a bad thing.
It's a bad thing.
And, we use these words differently than our patients do.
Mm-hmm.
This is an absolute true story. One of my friends, who is a physician, his mother called him and said, "Oh, thank God my flu test was positive." She thought that was a good thing.
Yep.
Now, who would call up some little old lady and go, "Oh, by the way, your influenza test was positive. Click." And what assholes. But anyway, that we do encounter that in this profession.
Yeah.
People don't think about these things. And negative. I've seen people get upset because their CAT scan was negative, thinking that it was a bad thing.
Yep.
So no, we don't worry about. Now there are Dr. Perkins. There are some funny things when people, instead of saying they have fibroids in their uterus, say they have fireballs in their universe, and instead of myasthenia gravis, say they have Monsignor gravies. I've seen that one. So
Or how about rotary cup instead of rotator
yeah,
cup?
rotary cup. I got my I don't
Tore
know,
my rotary cup.
tore my rotary cup.
I have to wonder about
It's
what
still going?
the doctor's attitude is towards the patient after
No,
that.
nothing.
Because
We either find it amusing or endearing, but it's not.
Or
We
both.
don't expect our patients to know Latin and Greek and stuff like that. It's crazy. So I do, though, if I have a doctor that there's a word that means programmed cell death. It's APOPTOSIS. Have we talked about this on the show before?
A little bit, but
Oh, we have?
yeah,
Okay.
yeah.
But people will pronounce that apoptosis, and it's like, God, that just makes me cringe. Now, I have a journalism degree, so typos, I see them and I have to fix them, and that kind of stuff. But apoptosis, it's not apoptosis. There's no Greek prefix that's apop, but there is a word ptosis, PT.
PTO.
Yeah, PTOSIS, ptosis, which means drooping, and apoptosis means falling away or falling away of leaves. Like you see trees, when the leaves fall, that's apoptosis or apoptosis.
Just sounds better when you say apoptosis.
No, and if you go on like Webster's Dictionary, they'll pronounce it wrong too.
Oh, wow.
They'll say apoptosis. They've got the computer anyway. So there you go. All right. Anything from the waiting room? Hell, I've run out of steam here.
Do we have any time left?
Yeah, we've got a little bit.
Yeah, real quick. Colin Carnes had a great question.
I'll be the judge of that.
Are there any over-the-counter herbal supplements, dietary supplements to help treat SIBO? Now, he did take our advice, I think.
Tell him what. So we're talking about small intestine bacterial overgrowth.
Right. Yeah.
And this one we don't have time enough, but you throw out something.
Yeah, but real quick, obviously the FODMAP diet can help, and there are some things that can help.
FODMAP is where you eliminate certain
foods,
sugars and
especially
things that the bacteria eat.
Yeah, that they love, and sometimes it's a lot of foods you would never suspect are really healthy foods otherwise.
Yeah.
So there are some over-the-counter supplements. If you'll Google them, you can find some, but there's a gazillion.
We'll give them one.
I can't think of one.
Oh, for fuck's sake! You were just temporizing.
No.
Okay, probiotics.
Yes. Well,
probiotics
but there's actually
can help.
some natural antibacterial supplements you can take, but they're all brands.
Really?
Yeah. Let me look it up. I know I've got it right here.
This is compelling.
I'm doing my best.
I
It was a
know,
quick
I know.
question.
We'll find it. It's a great question. We probably should answer questions that we know the answers to.
We know there are. We just don't know the.
Yes. Okay.
We-
So
we
if
do know
he's
there are,
asking,
yes.
are there any?
Yes.
He didn't say what are they. He
No,
just said, are there any?
exactly? And the answer is yes.
The answer is yes, my friend. There you go.
Follow up next week with the.
All right. Well, go to our website at drsteve.com for schedules and podcasts. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week, hopefully a little smarter, for the next edition of Weird Medicine. Thanks, everybody. All right.
My fingers just weren't fast enough.
Well, we can just go back for the podcast
Yeah,
and actually answer it. Okay, we'll do it right from
Yeah,
there.
yeah, ready?
Okay, you got
So-
one?
Yeah, I've got a couple.
Okay,
So-
well, hang on. I'm not quite ready.
I'm sorry.
Okay, so I just asked you on the regular show, give them one, and that's where I will switch over. Ready? Go.
So a couple of them.
Shit, fuck.
Sorry.
Oh, no, my fault. I really messed up there. Okay, hang on. Okay, you ready?
Yep.
3, 2, 1.
So philodendron has been shown to help with SIBO. Barberry has been shown.
Barberry.
Yep, barberry, Baber.
What the hell is that?
Yeah, I don't know. Oregon grapefruit, golden seal have all been shown to help treat the bacteria
Really?
that are
Get out
influencing
of
it.
here. Is there data on this? Or are
Oh
you
God,
just
yeah, the data is
reading some
compelling.
herbal website?
The data is compelling.
Shut.
Herbal therapy is equivalent to rifaximin, the treatment of
Rifaximin.
SIBO.
Rifaximin.
Sons of
Jesus.
bitches. Sons of bitches.
All right.
So there you go.
Well, that's because you're an idiot.
So which one? So which herbal things are equivalent to rifaximin? Because now listen, this is a big deal if this is real.
It is, yeah. And I just literally found it. Give me 2 seconds. I'm scrolling down to the bottom of the for the actual because what they've shown.
Okay, I'll just.
Well, yeah,
do
just
it.
stop.
By God,
Hey,
if you
I'm
want
looking.
something
I'm
done
looking.
right.
I can only type so quickly. But there are herbal formulas, and I'll tell you, it's actually in the NIH National Library of Medicine.
Okay.
PubMed. So it's PubMed. This is the real deal. You want the
Okay,
number?
that doesn't mean that it
Well,
means
that's
anything.
PubMed.
You can get listed in PubMed and be the shittiest.
God, here
journal
we
in the
go.
world.
Now all of a sudden
you
it's in-
can't.
Now it's in PubMed. It's
No.
not worth
You have
anything.
to. You have to look for the quality of the data.
Uh-huh.
Anyway,
Uh-huh.
okay, here we go.
Uh-huh.
Okay, cinnamon, thyme, and pomegranate. Oh, get out of here with this.
Oh yeah, no, Simmons very good. Thyme oil and oregano oil both have been shown to be anti-bacterial.
Parsley, sage, rosemary, and thyme. Right?
Yep.
It's for
Perfect.
okay.
Sprinkle it on your pasta.
Or your Simon and Garfunkel song. Let me see. Okay, we're gonna do some more research on this.
We will get an actual real answer
because
next
this
week.
is not good radio. You and I just looking at the internet.
Colin, I'm sorry, but the answer is yes, and I promise you next week I'll have some very good ones.
I'll tell you what, Colin, actually call in.
Yeah, that'd be
And
good,
then,
Colin.
yeah, call in the or send us a voicemail.
Hey, Kim Chickens is here. What's up, Kim?
Hello, Kim.
Hey, Kim.
Do you know anything about Uva Ursi?
Mm.
Oh, that's Bearberry.
Is she an actress?
That's Bearberry. Oh my God. Okay, we're getting out of here. This is getting ridiculous.